Hi everyone and welcome back. A slightly different format of Speed Beauty today. I'm going to show you a little vlog of a treatment, a laser treatment called ProFractional Laser that I was very kindly gifted from a lady called Dr. Sarah Tonks, who I've known for many years within the industry. And she was like, Caroline, I just want to make your skin the skin that you've always dreamed of. And I think this will really, really help. And I'm only 2 weeks, probably about 16 days since my treatment. Now you're going to be quite shocked at how I looked. If any of you have had any kind of deep laser, you will have sympathy. It took me such a long time to convince myself to have it. One, just because it's difficult to slot in the downtime and a busy life and kids and work. And secondly, I was quite scared, like, how am I going to feel? Is it going to be really awful? And actually it was fine. You just really need 3 days at home where you can keep your skin hydrated and clean and just kind of, you know, just batten down the hatches and let your skin heal. Basically, it's absolutely fine. But I've documented everything for you, and so watch the journey. I'm going to cut to a piece now from to introduce you to Dr. Sarah. And she's going to tell you exactly what it is, and then we'll go through to the vlog.
Hi, my name's Dr. Sarah Tonks. I performed Caroline's ProFractional treatment a few weeks ago. ProFractional is a type of erbium laser. It's an ablative fractionated laser, meaning it vaporizes columns of tissue in the skin. We use it for improving the wrinkles, clarity of the skin, any discoloration like hyperpigmentation. You can also use it really effectively for stretch marks and scar reduction. It's from a company called Sciton. They also make BBL, Moxie and Halo as well. I would say that the ProFractional is a more aggressive and can be a deeper sort of treatments than those other ones. So it's definitely not for the faint of heart.
So I thought it was quite nice to hear from the expert. So I went in at 10 o'clock in the morning. We did some before and after photos, which please follow me on Instagram, because this will probably take about 3 to 4 months to really kind of reach its full before and after potential. This is only 2 weeks. I've still got a while to go. It takes a while for the skin to really rejuvenate. So I can't show you an exact before and after now, but I know you'll be with me for the next few months anyway, so you'll see the progress, hopefully. So I went in, we did some before and after pictures, and then I had some numbing cream, which was much appreciated, and do not skip the numbing cream, on my face and on my neck. Sometimes that can feel a little bit weird. And then we went into the room and I had my goggles on to protect my eyes, and then Sarah worked with the laser for about an hour, doing sort of 2 or 3 passes on the different lasers. At that time I just sort of like switched myself off, but as I describe it was like a sparkler. And you're going to see me after the treatment. There is a little bit of blood you can see coming through. I'm just looking at myself down here, coming through the mask, and you've got like little scratches on your skin, but you know, that was very, very minor. Anyway, enjoy. So this is me post-treatment, which was about an hour. I had my eyes covered with glasses, so I couldn't film it. But Sarah gave me this amazing hose of cold air that I could just spray over my face, which was really renewing. Going home in the taxi, I felt fine. It almost just felt like a little bit of sunburn, so I felt confident. Oh, so I'm just home. The treatment was almost like having a sparkler on your skin and just going zzz, zzz, zzz. It took about an hour. I had the most amazing care and treatment from Dr. Sarah Tonks. I'm incredibly grateful for it. Really, really compounded the essential point of researching the person who is looking after your skin to make sure that they have brilliant reviews and you feel confident with them, because at that moment, if something went wrong, it would just be horrendous. So the treatment of like being zapped with a sparkler lasted about an hour. And then I had a mask on my face and spritzing with water and a cooling machine to bring everything down. At that point, I was sort of quite anxious at the heat in my skin, although Sarah told me that was going to happen. She was very reassuring, and I really, really was trembling. God, look at my face. Trembling, and I couldn't stop trembling. I guess because I had such bad acne when I was younger, and I had lots of facials, not to this level ever. I've never had anything like this in my life. It just kind of brought back a lot of memories of when I was trying to fix my terrible pustule skin then. So I think a lot of it's to do with that. I don't think everyone will feel like that. But I was quite, it was quite a thing. I couldn't really talk and laugh and joke as I do normally with Dr. Sarah Tonks. But anyway, I hopped in an Uber, I'm home, and I actually just feel complete relief to be home. Everything has subsided now. It's a bit stingy, as you could imagine, sort of around the edges. It's Willow, my son in the garden. Everyone has laughed at me, teased at me, said, go away, you look disgusting, which is, you know, boys. I didn't expect much else, really. My mum's coming tomorrow, so that's good. So I feel relief, and I know that it actually isn't going to be that bad. So, all good so far. I will fill you in on the next few days. My neck looks the reddest part, actually, which I can sort of deal with. Anyway, yeah, I just thought I'd let you know. Okay, so I just washed my face. It's about 5 o'clock now. Oh, that really stung. And Sarah's given me a lovely, like, super hydrating mask to put on my face and neck, which is stinging. So I'm definitely not out of the woods, but that would be ridiculous to think that I would be. But anyway, onwards and upwards. These are the skincare products that Sarah has recommended that I use after the treatment. And this contains a lot of copper peptides, which is excellent at renewing and healing the skin after a laser treatment similar to what I had, Neova. And this skin serum called Elastin, the recovery spray has been really lovely. It does burn a bit when I spray it on, but I feel like it's doing a good thing for my skin. So I've just woken up and it's very, very tight. I just feel like I want to scrub it off. So I'm going to go in the shower, use the special creams, and hopefully it will feel a bit less crusty. It's very swollen. The night was pretty rubbish, just because it felt so sore against the pillow. I did take a diazepam, which Sarah kindly gave me, which helped me relax. It wasn't awful. It was just uncomfortable. Now I'm going to get in the shower. Oh, I had to tell you straight away, I'm out the shower and the crust obviously has just softened. Puncher. I'm quite swollen, but not too bad. But that sort of tightness has gone immediately, just with the emulsification of the cleanser. I haven't even put the creams on. So it's okay. I'm gonna be fine. Let's get on with the day. Okay, so this is now day 3. And my neck is very, very sore. I haven't had anything that would irritate it, but it is very sore. I guess it's never really had any treatment on it. I was really swollen this morning, but the swelling has gone down. So if you can sit up or have as many pillows when you go to sleep, I think that would definitely help. But my face is slowly coming back to normal. Feels a little tight, and every time I wash it with this lovely emollient cleanser, actually it's not, it's just an emollient cream, and Dr. Sarah Tonks said to wash it in the shower, have 2 showers a day, because you'll help to move the debris, the dead skin cells, off your face, and you can really feel them come off. It's sort of quite stuck on my neck. So that does feel a bit like wearing today, although I feel happy with my face. If I could cover it, then I would feel a bit better, but I can't have anything touch it. Anyway, I'll report back on day 4. So this is day 5. Day 3 was by far the worst. but my face is totally fine. Just look a little bit, still swollen, but totally fine. And my neck, even though it looks very, very raw, I mean, it is in the crevices, it doesn't feel as it did the other day. So I'm going to go out and about today. I feel fine. I just can't get any clothes on it. So we're over the worst now. Day 5 has been a bit of a journey. But I'm hoping the results will pay off. But it feels tight if I move my head, but it doesn't look as bad as it doesn't feel as bad as it looks. That's the right thing to say. Okay, well, I'll let you know when I get back to sort of vaguely normal. Right, I'm out of the house. It's day 6. And I'm back at work. I would 100% say you definitely need 4 days. 5 days is fine, especially if you're at home. That's easy on the computer. Obviously, your brain is still completely fine. I think day 3, you're still a bit wobbly, just mentally. Day 4, you'll be absolutely fine. Day 5, absolutely fine. Day 6, I'm at work and I don't mind having a bit of redness. It's absolutely fine. It doesn't feel tight. I did just stupidly put on a little bit of concealer. Obviously, I didn't have any laser around my eyes. And I just spoke to Sarah and I said, is it for the same for makeup as SPF? Because you can't wear SPF for 10 days afterwards. I'm going to show you some hats that I've been wearing and bought, because you have very fine, tiny holes in your face and you can't let the chemicals go into your skin. So your skin just needs 10 days of absolutely nothing, only what it needs. And that's basically the skincare that I have shown you or will show you. And to be honest, when I was at my worst point, when it felt so sore, I was so grateful to be able to put something on my skin that didn't irritate it. And you don't want to further complicate it by causing any dermatitis or having to go on antibiotics. So it's really, really important. But even though it's still very early, you know, when the skin heals, maybe I'm going to be one of those girls that can just leave the house with a flush of bronzer and not a truckload of concealer and makeup like I've always done for years and years and years. That would be nice. But we'll see. Steady as we go, steady as we go. And here we are, as I said, just shy of 2.5 weeks later. So that's become, you know, it's a bit like a mortgage, childbirth. It becomes a distant memory, doesn't it? And I'm just looking forward to my skin improving. So I wanted to go through with you some of my major top tips, and I did allude to it early on in the film. Please prop yourself up with lots of pillows when you go to sleep. I didn't do that, and I think that's why the swelling was so bad. I think if you prop yourself up, you won't be so puffy. So that's my top tip. Secondly, having some thermal spring water. This was amazing. I put it in the fridge and I just kept spraying it on my face, spraying it on my face and on my skin, and it was so calming and healing. Only one time did it get really bad that I used a little bit of cryotherapy, my cryotherapy sticks. I'm sure I could have used them more actually. I just didn't really want to overstimulate it or upset the skin, so I just used it once when it was really in agony, and that worked extremely well. So in hindsight, I probably should have done that more. Now, there are a couple of products I wanted to tell you about that Sarah had given to me, which were amazing. The first one is by a brand called Neova. Now, this is their CU3, so it's their copper recovery spray, copper peptide complex. And actually, Charlie, who works with Sarah, said that these products have speeded up the healing process in the skin by at least 2 days. So this is a spray that stung my face, but then I wafted it with a fan and my neck, mainly because my neck was the sorest part. Interesting to see how tight that becomes. Not tight, but how much more healthier the skin will look on my neck. So I'm looking forward to that if that does happen. And I felt that this was really, really doing my skin well. So this I would definitely have again. There's another brand called Elastin. And these were the 2 products that I used religiously. Elastin Skin Nectar, and the Neova copper peptide tissue repair. You're not meant to go off. You can use like Aquaphor and Vaseline and things like that, but I wanted actual properties in the skincare to help the healing process. And I didn't want anything to sting it, because that is the last thing that you want, is your skin to react. So 100% really, I mean, either use any of the Neova or Elastin products. They are absolutely fantastic, and I think when you're in a bit of a pickle with your skin, you just want to use products that you know are not going to react, create any further allergies or irritation. They're just going to protect your skin. So that was very, very important. There's also a new product that I've just treated myself to called the Ultimate Redness Relief, which I was putting on my neck because that was slower to heal, and that has been very calming actually. And I'm going to use all of these products until the end, and then I will slowly introduce my normal skincare, but obviously stay off the retinols and the vitamin C's. And obviously I need to stay out of the sun. Now that was the tricky part, because we actually had some really beautiful weather in the UK when this happened. So I got myself a couple of hats, and this little guy was my best friend, really. My little bucket hat, because that, with my hair forward, just kind of hid everything. Obviously I didn't look at the sun, but just kind of like walking the dog and stuff, I felt like all around my face was protected. And that was only sort of like early mornings and evenings, and the rest I just had, you know, classic sort of baseball cap on, just to kind of keep my face out of the sun before it has the SPF on. It was really strange walking around without SPF on, because we're so used to it. But because the skin has small holes in it, little perforations from the laser, you can't put any SPF on a skin that is not sealed, because it will cause dermatitis and irritation. I think I talked about that in the film. The SPF that Sarah recommended, which I have used at HelioCare before, I found it sort of quite thick and heavy, but this is actually very nice. It's the mineral tolerance fluid. Now again, she said don't use the chemical, because the chemical will keep the heat in your skin and produce the heat, whereas the mineral creates a block and bounces back the sun rays. That's quite an interesting tip, I thought. This has been absolutely fantastic, meaning that I haven't had any irritation from it. It's very liquidy. It looks like it's sort of slightly tinted, but it's not. It's just the coverage in it. And I've used quite a lot, and I've just sort of pressed it into the skin. Not that my skin is sensitive in any way. I can still sort of feel the heat in my skin. It doesn't feel like my old skin. It feels like it's kind of like there's a lot of rejuvenation in there, which is a good thing. And I'm really, really sort of excited to see the difference, especially sort of in my pigmentation and the texture of my skin. I sort of feel a bit like a reptile or a snake that's kind of shed its skin. It feels super, super soft to touch, which is a lovely feeling in itself. And for me personally, I just want to have a lovely radiance to my skin and a smoothness to my skin. And if I can kind of beat back that pigmentation and, you know, soften those fine lines for as long as I can, then I'll definitely recommend this treatment. I can't recommend it just yet. I'm sure I can. I know I will be able to, but I'll be able to show you the before and after pictures sooner or later. Well, in about 3 months. In the autumn, we can have a little look. And I think you're so used to seeing me on camera anyway, you'll be able to see the difference as it goes. So if you're looking for a rejuvenation, a deep rejuvenation, I can highly recommend this as a treatment so far. Please let me know if you have had this type of laser, ProFractional laser, what your experiences are of it. There are other levels that are even deeper, but this is as far as I want to go right now. honestly, my deepest thanks to Dr. Sarah Tonks. She is an absolute font of knowledge. She also tries out so many of the treatments herself and her team, so they know exactly what they're doing firsthand from a personal experience, which I think is absolutely brilliant. If you want to know more about the products, you can also speak to experts such as Dr. Sarah Tonks on a platform called Get Harley. We'll put a link in it below, or contact Sarah if you want more information. I'll put her details below as well, and you can speak to Charlie, who is so informative. I mean, probably it's best to have it this sort of like from September onwards if you live in the UK or, you know, in Europe. But yeah, I've managed to sort of stay out the sun. It's only really for 2 weeks, so it hasn't really been that much for bother. But yes, I'm looking forward to seeing how much it will improve. And if you've got any other questions, I know Sarah will come on and answer those. And yeah, follow her for more information. She's got a brand new clinic in Beecham Place in Knightsbridge. It's going to be amazing. It's just being refurbed. It's very exciting. So she is a complete expert and a trusted woman in this crazy world of aesthetics. But I trusted her with my face, and I will trust her for anything. So thank you for watching, and well, we'll continue the conversation on. Bye for now.